Hi, Dr. Joe Alaimo here again. And I want to thank you for filling out that free diabetes report request. I'm going to make sure we get it out to you as soon as possible. You're going to find tons of information in there that you can't find anywhere else. And that's because we've thoroughly researched this topic and we get great results in our office doing things just a little bit differently. You see, if I did things the same way as everybody else, then I'd probably get the same results. But in our office, we look at things just a little bit differently. We do different tests, different procedures, and quite honestly, we get different results. We treat patients and help patients manage their diabetes who have been diabetic for 25 or 30 years, and we help them get their blood sugar under control. Now, if that's something you're looking to do, I want you to pay close attention to the rest of this website and everything else I have to tell you here in this video. See, I take diabetes very, very seriously because all of my chronic health patients have blood sugar problems, either too high or too low. Now, you can be diabetic, pre-diabetic, insulin resistant, metabolic syndrome, or syndrome X. These all essentially mean the same thing. They all mean that your blood sugar is rising too high. Once it gets over 126 on 2 successive readings, fasting, you're considered diabetic by the American Diabetes Association. My goal, first of all, is to hope you never get to that point. But once you've reached that point and you're on 1, 2, 3, 4 different blood sugar lowering medications, plus I guarantee you that you're on some hypertension medicine and you're probably on some cholesterol lowering medication, because these 3 things go together. I'll explain that to you once you come into the office and we go over a consultation. And the physiology is very unique and it'll make a lot of sense to you once you do that. Now, what I want to do in this part of the website and this part of the video, just explain to you a little bit about why I'm so passionate about diabetes and the devastating effects that it has on patients' lives. First of all, we need to understand that in the last 50 years, diabetes has gone up 700%. 700%. That's more than any other condition that we know of, yet it involves many other systems and can cause problems in a lot of different systems. So we eat the standard American diet, or SAD. That's a lot of processed foods, junk food, fast foods, and bottom line is we're gaining weight, we're becoming obese, we're becoming sedentary with video games and DVRs and all the other things that we do, and we're not outside, we're not enjoying life really. And as we get bigger and more lethargic and blood sugar starts to affect our lives more, it affects our brains, we start getting brain fog, and we just don't want to do anything. But some of the things that diabetes will cause is, it's the #1 cause of blindness between the age of 20 and 74. It's the #1 cause of kidney dialysis and kidney failure in the country. It's the #1 cause of below-the-knee amputations. In 2004, 71,000 were done. Okay, it increases your chance of peripheral neuropathy, burning numbness, tingling into your hands and feet by 60 to 70%. It increases your chance of Alzheimer's by 65%. That's something that most people don't know. As a matter of fact, they're coming out with a new term now that I've been reading in the research called type 3 diabetes, which is Alzheimer's. Essentially, your brain is being starved of sugar. So these things can be prevented early enough in life if you do the right things. That's again the purpose of why I'm trying to share this information with you. Diabetics have an increased chance of cardiovascular disease and stroke. That's why they put you on Lipitor and cholesterol lowering medication. That's why they put you on the antihypertensive medicine, blood pressure medicine. Also increases your chance for gum disease, periodontal disease. Again, things that we don't normally associate with diabetes, but it's very common. So why do I say all this to you? Because in today's society, we have 23 million diagnosed diabetics. Okay? Another 57 million as pre-diabetes or insulin resistant. Just one step away from diabetes. That's about 80 million people. They say that right now it's about 1 in 4 people have diabetes or insulin resistance. That number is going down to 1 out of 3. With all the devastating side effects that I just told you, don't you think it's important for you to try to figure out what's causing your diabetes and what you can do to actually get control of your life again and maybe reduce your need for some of your medications and actually improve the quality of your life? That's the question you have to ask yourself. Now, my job is not to put you on medicine or take you off medicine. Medicine has a great place in our protocols and in a lot of other doctors' protocols. So some medicine is definitely necessary. That's not what I'm saying. But what I'm saying is if I can improve your physiology, make you feel better, make your body work better, there's a good chance that we can decrease your symptoms, which may reduce your need for some medications. And that's our overall goal, is to improve the quality of your life, add value to your life. Maybe reduce your need for some of these medications. Okay? Maybe slow down the progression of the disease. So it's important for us to find out the exact cause of your problem. That's where our leave no stone unturned actually comes into play. And that's what we need to do. We need to leave no stone unturned to figure out what's causing your problem. So if you want to have a consultation with me in the office where we'll review your case and figure out exactly what's going on with you, we can do that if you fill out this form, and somebody from my office will get back up with you as soon as possible. Thanks. Fill out that form, and I'll see you soon.